Two pallets of hundreds,
Yeah,
eh?
yeah.
2 pallets of hundreds. So we need to get that in here. So you guys have to see how you're gonna get that in here. Maybe shift that over there so that you can get this in. As we enter, we would normally come in, then we will check the apples, see if there's enough boxes for all the orders that we're going to send out. We also check the quantities in the boxes to make sure there's the whole pallet is 100 or is 80 or all that. We put the labels on each box, depending if it goes to the north of the country or to the south or to the west. Our orders come from all corners of the country, so that is basically what you'll see we're doing here today. Once all the boxes are done, each box has the labels on from the different branches that ordered. Then we wait for Namepost Courier or JetX to come and collect the boxes, and then they will load it into their trucks, and then it will go off to the depot. Boxes for Chicago. And do these ones, and then I'll just need to write 2 more. Normally what happens is once we're done with the daily distribution, then we bring the record of all the apples and all the juice that we've distributed for the day, just for the warehouse records as well.
Quite interesting. Apples are being harvested January, February, and March. And then they store it in CA rooms where all the oxygen is being subtracted or tracted out of the rooms. And then they store it at minus 0.5 degrees Celsius. As you may know, that apples can't be harvested throughout the year, and that's the way that they do it. As apples are being needed, they open up the rooms, put oxygen back, and then sort the apples and pack them in different sizes and packaging. And that's why we've got apples right through the year.
I'm Izaan Engelbreg from JetX Couriers, a subdivision of FP Retoy Transport. As soon as we are notified by Bank Windhoek that the apples are ready to collect, we then send vehicles into town, as we are stationed in Brakwater, to go and fetch the apples at Fresh Produce. We then immediately return back to the depot and offload it into our warehouse, which is cooler and tempered controlled, just to ensure that the apples do stay fresh. That evening, it's loaded out to all our destinations, which is our depots. And when it arrives at the depots the next morning, it's then distributed to all the Bank Windhoek branches. We deliver to the northern, the coastal, and the Okanya areas. And this is one of the best ways to give back, where we can help the community to be healthy, strive, and grow the economy, which will only be a benefit to us all.
My name is Agnes Kalyanda, and I am from Namepost Courier. Well, this is how the distribution works. Once the orders are ready, our team of drivers here in Windhoek go out for collection. They collect it from the warehouse and they bring it back to our depot here in Southern Industry, where they are then inducted into our system. After that process is finalized, they are then sorted according to towns, into different towns that they are going as per order. And when that is done, it is loaded onto our trucks and then they're delivered to all various destinations that they are going to. When the opportunity came about for us to join Bank Windhoek in support of those suffering from cancer, it was one that we could not let down. Therefore, we joined and we find ourselves here now.
All right, so the Cancer Apple Project is really a highlight on our calendar at Bank Windhoek every year. It's launched just before winter normally, so that we are able to deliver fresh quality apples across the country. So once we launched the Cancer Apple project, our branches really change into shops that are able to receive orders for apples as well as distribute apples. We have 3 ways of actually contributions to the Cancer Apple project. So one is the actual physical apple, which is $6. The other one is through our e-Apple platform, which is an electronic platform that we have created where people can go online and order apples. And then the third one is apple juice. At a cost of $10, the public can then order any of, whether it's a physical apple, whether it's an electronic format of an apple, or juice to contribute collectively to the cause against cancer in our country. Corporate social responsibility, it's not just about giving. It's really making sure that the impact is felt at community level. So when we see the rise of cancer in Namibia, like we have seen now, it is collective responsibility from private sector, from NGOs, from public to address this challenge. So I just want to urge the public and everybody, it's not about Bank Windhoek, it's about the greater good of Namibia and saving lives.
Be aware of going for screening as individuals and also as the medical fraternity to be more out there and more aggressive in the primary health sector, in screening, going and getting tested, having your mammograms, getting your pap smears, getting a PSA and going to the urologist to take a check at your prostate. And this will, in the end, save lives. In fact, we are busy seeing it now, even with our breast clinics that we have recently started about 1.5 years ago. And we are starting doing early screening, and we are starting to see women now in stage 1 and stage 2 with successful outcomes. So I implore the community, let's hold hands, let's come together, and let's start screening patients so that we can save lives. Thank you.
And now, the Palliative Care Namibia program also benefits from the Apple project, because not all cancer journeys end successfully in cure. Some of them lose the battle, and we need to give them a good and an honorable and a beautiful, pain-free farewell. Please support the Bank Windhoek Cancer Apple project. Each apple truly does help fight cancer, save lives, and now even gives a dignified end to those who do not survive this disease.
My boss and my colleagues and my children, they were always with me and always giving me courage and lift me up. So after that, when I come back for my results, it was now 6 months after. So Dr. Simasiku told me that, "Oh, Martha, what a miracle, you are fine." I was crying like nobody because of joy, because I was a little bit down, as I know my mother died of cancer, and I'm the elder sister for my sisters. So by the grace of God, I'm here, I'm fine, I'm fighting, I'm still a fighter, but I'm okay. With God, everything is possible.
So if we talk about the fight against cancer, it's always about prevention, then early detection, then all the medical management, and then palliative care, looking after the cancer patient holistically, mind, body, soul, and spirit, which is as important as all the other treatments. So I think if you can all try and look at all the preventative things that we can do to prevent breast cancer. We can't really prevent it, but we can keep ourselves as healthy as possible. So we can make sure that we don't pick up too much weight. because we know that obesity and lack of exercise are very important reasons to get lifestyle cancers like breast cancer. So we can make very sure that we look at our diet, that we have a low fat and low sugar diet, high in fiber, high in vitamins, and do regular daily exercise, even if it's just walking or climbing the stairs at the office, or but keep active. And then if we have a strong positive family history of breast cancer, then we must make sure that we do go for our annual checkups.
If we don't have the data, how can we support, how can we make that plea to government? Government also needs numbers. Government needs to be told this is what we're seeing on the ground. We can't just go there and say we need help for cancer. That's not going to work. So we have to start with screening, get the stats, and with the stats we can enforce and equip our hospitals to help and gear up for the cancer fight.
To address this, the Cancer Association of Namibia established the National Cancer Outreach Program, another focal point where the annual Apple money goes. We travel all across the country to screen and help fight breast cancer in our country. Now, all of these patients need to go somewhere. So to help the patient load and to ensure that we can save lives, we've established the breast clinic here at the OPD, outpatient department of Windhoek Central Hospital. So what basically happens is we travel all around the country, we screen, and then we refer to this clinic back here. And then we do the diagnosis, and then we start with the treatment, and so we start saving lives. We've seen a reduction in metastatic disease, and we've seen a reduction in advanced breast cancer already. And this means that together, your apple purchase one at a time, juices purchase one at a time, and support of this project is truly impacting lives. Thank you, Namibia. After COVID, we went down into a slump and we were sort of, okay, we don't budget, we don't aim for the stars. We sort of, ons is nog in Namibia. We're in Namibia, we're there by the Fish River Canyons and Namib Desert. And then all of a sudden, this. Huh? How amazing is that? So to every Namibian out there, thank you. To every Bank Windhoek staff member, Capricorn group member, thank you from all of us in the fight against cancer. Salute. Thank you.